In the realm of medicine, particularly in the field of homeopathy, where remedies often share similar indication, comparing two medicine can be a challenging task. Avoiding confusion while assessing the nuances and differences between two medicine is crucial for accurate prescription and effective patient care. So in this video, I am sharing how just by one symptom you can easily differentiate and ensure clarity and precision in your medicine selection. Welcome to Quick Hacks for Homeopaths. So let's dive in and see the comparison. The first medicine is equisetum or epis or cantharis. In cases of urinary tract infection, check for the quantity. If there is large quantity of clear watery urine, it is equisetum. Whereas in epis and cantharis, the flow will be scanty, even just few drops. Next, Eupatorium perf versus Brainia. Whenever fever patient comes to you, if the patient is sweating very scanty and because of pains the patient is restless, think of Eupatorium perf. While Brainia, patient will be sweating freely, a lot of perspiration, and even in pains the patient will want absolute rest and will be lying quietly. Let us see gelsemium and coffea. Ailments from bad news is gelsemium, whereas coffea patient has ailments from pleasant surprises. Let us compare gelsemium and digitalis. In case of chest complaint or heart problems, patient will say that unless moved, my heart will cease beating. So, gelsemium patient will keep moving, continuously in motion. Whereas in digitalis, the patient will say, if she moved, her heart would cease. So, they would want absolute rest. Let us see Helleborus and Baryta carb. In cases of acute idiocy, always think of Helleborus. Acute mental retardation, think of Helleborus. Whereas usually Baryta carb is given in chronic states of mental issues or idiocy. Let us compare two remedies, Hipposulph and Nux vomica, with camphor and Sickle core. Now, in cases of fever, in fact, any set of symptoms, Hipposulph and Nux vomica patient cannot bear to be uncovered. They are very, very chilly patient. Whereas if you compare them with camphor and Sickle core, these two patients cannot bear to be covered. They are very, very hot in thermal reaction. Let us compare Hipposulph with sulfur. The skin of Hipposulph will be moist, but the patient cannot bear any kind of touch on the skin because they are very, very sensitive. Even in the skin complaints, the Hipposulph patient would not allow you to examine the skin. Whereas the sulfur patient, if you notice, the skin will be dry, patient will have a lot of itching, but they will be ameliorated by scratching. So patient will be continuously scratching. There is no oversensitiveness in sulfur. Let us compare Pulsatilla and Ignatia. Pulsatilla patients are usually fair and they are slow and they are indecisive, whereas Ignatia patients are usually dark colored, dark haired people, but their execution is usually quick and rapid. Let us compare Graphitis with Ignatia. If you see a pediatric case and when you ask what is the reaction of the child when they are scolded, if the parent tells you that the child will laugh, they will giggle when they are scolded, think of Graphitis. Whereas if the child falls sick whenever they are scolded by parents or teachers or anybody, think of Ignatia. Let us compare Calibicromicum versus Lachesis or Aurelia. In cases of chest complaint where there is dyspnea, Calibicromicum patient will be ameliorated by lying down or rest. Whereas in Lachesis and Aurelia patient, the patient will be worse on lying down. So, they will be sitting. Let us compare Calibicromicum with petroleum and alumina in cases of skin complaints. Calibicromicum patient will be ameliorated by cold weather, cold in any form, whereas petroleum and alumina patient will be worse in cold weather, winters. They will have all the skin troubles coming up. Let us compare Calibichromicum with Zincum. Whenever we see fidgetiness of limbs in cases of our patients, if it is particularly fidgetiness of hands, a lot of motion of hands, constantly the patient is moving the fingers, think of Calibichromicum. Whereas if it is in the feet, think of Zincum met. Let us compare Calicarb with Brynia. Both of them have stitching kind of pains, but what differentiates them is the modality. Whenever the patient is worse on rest or lying on the painful side, think of Calicarb. But if the patient is relaxed or ameliorated by resting, absolute rest, and lying on that painful part, that is heart pressure, think of Brynia. Now, let us compare Kalmia with Iodum. Let us compare lachesis versus Carbovec. Now, in cases if the patient has sudden hypotension and they require fanning, if they want fanning to be done slowly on their face, think of lachesis. But if they ask you to rapidly fan on their face, think of Carbovec. Now, let us compare Medorinum with oxalic acid. In Medorinum, many symptoms, a whole set of symptoms will be worsened when the patient will be thinking of them. Whereas in oxalic acid, it is particularly the pains will be worsened while thinking of the complaints or the pains. Now, let us compare Lilium tick and Causticum with creosote and maca. This is in reference to the female complaints. When the menses flow only when moving, think of Lilium tick and Causticum. Whereas if the menses flow only when the patient is resting or lying down, think of creosote and maca. So thank you for watching this video. I will be coming up with some more comparisons in part 2. Do subscribe for more such videos.